Hey everybody, it's Jen from Two Moms in a Wine Truck, and I'm coming to you on this beautiful Tuesday evening. I'm hopefully thinking that everybody get outside today. Keep your social distancing as usual, but it was just a gorgeous day, and so I'm sitting here having a wonderful glass of Chardonnay tonight. That's my choice. So hopefully, for those of you that can drink, are gonna grab a glass of wine and join us. So tonight I'm here with two of my friends, Jordan and Amy, and they are from Indiana Birth and Parenting. And we are going to talk about another segment of the population that is still going on and will continue to go on, and that is our baby mamas. Just because we are quarantined in our homes doesn't mean that births have stopped. So they are going to give us some tips and tricks and talk through how birthing may have changed a little bit in this upcoming weeks and upcoming month, and to get everybody prepared. So Jordan and Amy, welcome. Glad you ladies could be here tonight.
Thank you for having us.
Absolutely. So Jordan, Amy, why don't you give us your quick bio, and then what I'd like to do is talk about the platform of a doula and what you guys for birthing and parenting, and maybe dismantle a couple of so forth of myth busters and so forth. So Amy, I'm going to start with you.
All right, so I'm Amy. I'm a mom of three, married my high school sweetheart. I'm on the opposite end of parenting compared to Jordan. My kids are in college and high school. Jordan and we're going to be marking our 1-year birthday or anniversary of our company this Friday on April 10th. So we are super
Congratulations. I'll
excited.
drink to that.
Thank you. Yeah. So Jordan and I met a couple of years ago, and we just decided, after a lot of thought, discussion, and research, that we just wanted to dive in and do something different than anything that's offered here. So Jordan, you can go ahead and share a little bit more about our company then.
Yeah, so like Amy said, we started our business about a year ago, and kind of our goal is we're doulas, so we support women through childbirth and then postpartum, but we also just want to be a resource and an information tool for those specifically in central Indiana, but then also beyond that, because a lot of like the content that we provide, it's anyone that's going through a childbirth. So just helpful resources, whether it's on our blog or on social media.
Fantastic.
Um,
Jordan, you're a mommy of how many?
so I have two boys. I have a almost 3-year-old and a 5-year-old.
Oh, you're having fun right now, aren't you? I love it. I love it. Well, ladies, when we were kind of talking offline to get set here, back in the day, 2 months ago, let's even go that far, you were allowed to bring in family and friends and just have a party, and heck, even the janitor maybe even showed up. You didn't care at that point in time. You just wanted the baby to come out and meet it. So let's kind of break it down a little bit, what you are educating, what you've seen, what you're reading, for our audience here who is expecting moms to be real and honest about what they may start to experience and encounter when they actually check into the hospitals.
Yeah, so obviously there's a global pandemic happening, and so that's kind of changed the outlook of what it means to go into the hospital and have a baby. I think that a lot of moms are really concerned. They've heard the news headlines that even some partners aren't even able to come into the birth room. So that's brought up a lot of anxiety in preparing for a childbirth. Hopefully, it people are trying to get the message across that it's important to at least have one support person in the laboring room, and it's very important to birth outcomes and just like feeling safe, because you want to feel safe when you have a baby. But some other differences that you might notice, I hope that you'll be able to have a like your birth partner, but it will be a more intimate birth. So you're not going to have grandma or all kinds of people in the room, and honestly there's going to be even fewer like nurses and helpers as far as medical staff in the room as well. They're going to keep those people even off the floor if they're not a necessity. So and then also they may change which entrance you go into at the hospital. They
Okay.
may have you wearing a mask at some point. They're going to check temperatures and like ask questions to make sure that you're not showing symptoms, because they want to keep everyone safe, the medical staff and your baby and
Right.
you guys, the laboring family. And then if they are allowing a partner, they're going to want that person to stay in the room the entire time. So no leaving to go walk the dog or
Okay.
go help out with the toddler. If they come, they have to stay in the room the whole time. So
Okay.
just preparing for that.
So Amy, question for you. So are things changing? Because I went with a big old bag and my pillow and my blanket and my loveys and all of that. How are they approaching that situation right now? What have you heard, read, and saw that is allowed in the rooms?
Right. So, from very reliable resources, they are asking people to only bring either what they absolutely need, and that means medication for your spouse or your partner,
Mm-hmm.
toothbrushes and things like that. But they are asking that anything that the hospital supplies, they would love for you to keep that at home. Two reasons. One, you bring a pillow, you bring a big old fluffy robe, you bring your
Mm-hmm.
slippers that you wear at home that you're going to wear in the hospital. That means you have to sanitize those when you get home. That also means that this little monster virus, not little, big monster virus,
Mm-hmm.
is not showing up in, some people are asymptomatic. So you could have it, your partner could have it, it could be all over your belongings. You're not showing any symptoms. You don't have a fever. You don't have a cough. You don't have a
Right.
sore throat. And then it's all over everything. And as it's on your pillow, and when you lay back on your pillow when you're in labor, that is going to kind of poof out into the air. And everybody around you that is in your room is going to be inhaling that. So it's twofold. They're asking for you to just be smart about bringing in what you truly need,
Mm-hmm.
which is so hard because we always preach to our clients, especially like this should feel luxurious. This should
Mm-hmm.
feel warm and cozy and safe. And unfortunately, that atmosphere is just not possible right now. So
Yeah.
we're trying to spin it and think, okay, now our goal is to keep everybody healthy and safe. So what does that mean? That means that I have to keep my pillow at home or my blankets at home and use
Right.
what the hospital has.
Right.
So it's sad and it's unfortunate. And we've had some people say like, this is just too much. It's an anxiety. And then we just try to say, okay, let's refocus that. This means that your partner can be in there. Do you want your big
Right.
fluffy pillow? Do you want your partner?
Right.
So it's really, it's unfortunate and it is very hard and sad.
So let's talk about our amazing healthcare force that are on the front lines right now because they are working overtime. They're doubling up. They're sometimes acting as a partner if they need to in the labor room and whatnot. And I think that personally, the way that people may interpret this is that it's sanction this, sanction that. They're just following the rules. So let's talk a little bit about that because we
Absolutely.
love our healthcare workers and we can't be
Yeah.
mad at them for the rules that
No.
they have to follow.
No, they are following rules from heads up that aren't even necessarily in the hospital, maybe not even in the state. Some
Mm-hmm.
hospital networks here, the main hub isn't even here in Indiana. So these are decisions that are not being done nationally, but a lot of the hospitals are kind of following the same protocol. And the people working there, they don't want to go into
No.
your room completely
Right.
in a spacesuit and mask and goggles or goggles and everything. They go into labor and delivery especially because they want to connect with you, they want to care for you, they want to also make you feel safe. Their lives are turned upside down, probably more so than the people coming in to have those babies.
Yeah.
So it's really hard for them, especially if you show up and your partner is symptomatic and they say that they can't come in.
Right.
That's going to be heartbreaking, and that has happened.
Right.
So they are doing everything they can to care for you while they're there. You will create a bond. Anybody that's had a baby knows this. When you're with your labor and delivery nurse, there's just a bond that is
Mm-hmm.
created, and that is going to be times a million right now.
Mm-hmm.
So you are really going to bond with the people that are there caring for you, and they want nothing more than a really good outcome for you and baby. So they
Awesome.
want this thing to
Right.
go too.
Right. So Jordan, as we think now, you've had a great delivery and you're ready to exit the hospital. A couple things come to thought. Now we're back in society because we've kind of been enclosed with our little baby or twins or triplets or whatever you're having these days. things to think about from literally leaving the hospital to getting home. And now that I'm home and I may be a single parent, or I was going to plan on having family come over and help me, now it's just myself and my partner. How does that planning process, what should people be thinking about now from the time they leave the hospital to, maybe 4 weeks out, including formula, diapers, whatever they need? What advice do you have on that?
So one one thing before that, just remember hospitals are letting moms go a little bit earlier than normal. So what would typically be like a 48-hour stay for a vaginal delivery is now getting cut down to at least 24 hours.
Oh, wow.
So they are trying to limit your exposure inside of the hospital. So most importantly, it's making sure you're recovering okay. So you're going to be a little bit more, you're going to need to be a little bit more aware of your recovery when you're
Mm-hmm.
not in the hospital that extra amount of time.
Mm-hmm.
Hopefully, both partners are non-essential workers and they're going to be home during that immediate postpartum to like kind of navigate that together rather than one instantly going back to work. Um, but yeah, it's going to be a little bit different and more, again, more intimate at home even. And you're going to want to get supplies. Hopefully, if you're pregnant, you're getting some of those supplies now that you may
Mm-hmm.
need. We suggest, even if you're breastfeeding, to go ahead and have some sort of formula in the house so you're not having to figure that out with limited store closures and lower supplies.
Mm-hmm.
So just kind of having some of those resources available to you now would be really great. And then also just having a little bit extra of diapers. We're not saying go buy carts full of diapers because
Right.
everyone needs them, but extra. And then as far as other baby things, I know that baby showers are getting canceled and Amazon's a little bit slower. It really doesn't take much. I mean, they need a safe sleep space. They need a few onesies or swaddles, and they
Mm-hmm.
need some diapers and a source of food. So very little as far as items go that you truly need. Everything else is just kind of luxury. And if you can learn how to take care of a baby with the basics, you're going to be
You're good.
set.
You're
Yeah.
golden. I love how you said essential versus luxury because I think that's true. And there have been a lot of virtual baby showers and what going on. We can continue to have them. That's great. But if you have the foundation of eat, sleep, baby poops, changes that, I mean, that's basically the cycle for the first X amount of weeks, months, anyways. You're right. And I like the fact that you said, even if you are breastfeeding, have formula just on backup because you may not be able to have resource to have somebody come in and get your whatever. So Amy, would you like to add anything to that, what Jordan said?
We as a company, we've approached this delicately. We want to be upfront and we love to give free information at everybody's fingertips.
Mm-hmm.
So before this even kind of happened, we've been preparing for it as a company and also personally in our own homes. So we were prepared and we've put out a couple of blogs about this that have been insanely, like thousands and thousands. People from all over the world are checking these
That's
out. But
great.
one in particular is that we put out a blog that gives you everything that you absolutely 100% need for 2 to 4 weeks in quarantine with a baby. It's on our website and on all of our socials. And it's literally lists everything. We've even put Amazon links on it where you can just order it, download everything and order it. So
Right.
and again, it's not luxury. It's not the things that you necessarily want, but it's really the things that you need in order to help babies thrive during those first
Yep.
couple of weeks of life.
I love that. So
Yeah.
speaking of resources, so mom goes home, partner goes with, or however, whatever that family arrangement situation is, resources. Mom gets home, postpartum, let's just face it, it happens to many, many women. It does. They are now locked up in a house with a new baby. Partner may need resources too. So do you ladies have on your website, or what do you advise? Is there a number people can call? What can we give out there that if you do get to that point, who to reach out to for help?
Absolutely. We don't have a list of resources on our website right now. It is something that's going on and help you connect with someone, we do suggest, if you're already feeling emotions and high stress during a pregnancy right now, I would be finding someone right now instead of after the baby arrives, because everyone could handle like having someone to talk to, especially when they're going through something as big as bringing a baby into the world during, this situation. So that would be my biggest suggestion, is to start looking for someone now, because it never hurts to have someone to talk to or
Sure.
someone in your toolbox. But yeah, typically we like to get a little bit of a feel for what's going on, and then give those resources out individually. But I know that IU North has a great program for moms that are going through some postpartum depression. They have a great resource. And you can, no matter even if you deliver there or not, you can go onto their website and find that. And then psiinternational.com is like a postpartum perinatal mood disorder website that has all kinds of resources on there as well. And I also believe they have virtual like group therapy.
Oh, that's great. That's wonderful.
Yeah.
Amy, any other resources you'd like to add, or advice about, when you get to that situation?
Yeah, so we always, all of our clients, and especially now, being prepared is the biggest tool that you can have in your toolbox. So with that, we are offering, we've been doing this for a few weeks now, and we have, our phone number is open to anybody for free. They can call us anytime during business hours. If it's an emergency, even after hours, that's okay. And like Jordan said, a lot of times you just don't want to give a blanket, here's who you need to call. We like to talk to everybody first. It can be something as simple as, you know what, it's feeding, that's what's out, so let's figure out what's going on with that. Some help sources with that. Or it's sleep, so let's front loading and have conversations with your partner about who's going to be doing what at 2 a.m. before you go to bed, so you're not having those conversations at 2 a.m. So a lot of times it's just very small things like that that doesn't require professional help. However, there are a lot of times that are. So when we're able to talk to someone on the phone and connect with them on the phone, we're able to figure out who they need, and we have that information in our own toolbox. So our phone number, our business line is open for anybody. It's free. It doesn't matter if you have another unit anywhere. It's not just here in Indiana either. We've had calls from out of state too. So
that's great.
Yeah. And you can also, we much prefer to like have a conversation just because we can hear your voice, but you can text that number as well. If you're just feeling a little bit uncomfortable calling someone, because we know in this day and age, a lot of people like to text, you can text that number as well.
That's awesome. Okay, so Amy, Jordan, I know it's Indiana Birth and Parenting, website, social media. How are they getting in touch with you all?
Yeah, so it's indianaparenting.com, and then we're on Facebook and Instagram at Indiana Birth and Parenting.
Okay, perfect, awesome. Ladies, this was very helpful. Again, not normally the topic we talk about with the wine truck, but guess what? It's still a population segment that we need to be concerned, and I'm so glad you gave some wonderful advice, guidance, tips, and tricks, and we appreciate both of you being on here. So cheers, everyone. Two Moms and a Wine Truck. We love everybody. Stay safe, social distance the right way, and be safe out there. Take care, everybody.
Thanks for having us.